skim through them. And second thing is, I always say general surgery is far more scoring. This paper had so much general surgery. I hope you would have studied it from me or an anatomy or an ENT and you would have gotten the questions right. Okay. There were some tricky questions, but those are not our target. Our target is the basic standard normal questions. Tough questions थोड़े होते ही हैं, but that's okay, right? We don't need to get all questions right. We need to get the straight normal questions right. So let's see. थोड़े tough थे, not gonna lie, but the easy ones वो तो आने चाहिए, right? So mother went to a pediatric surgeon. Child had a groin swelling, and when the child would cry or urinate, basically strain, the swelling went down medially. What is the likely cause? And I'll just give you a disclaimer. These are not exact questions. They were big clinical STEM questions, so they would have troubled you. I have just gotten the crux of the question. Okay, so don't say this is not the exact question, because I'm only telling you this is not the exact question. None of these are exact. I'm just going to give you what I got in the recall, the crux of the question, so you understand the topic. So if a child, 1 or 2 year old, has a hernia, it will be an indirect hernia. Option B here is the correct answer, patent process vaginalis. Okay. Direct hernia is seen in senior people. Male or female or doesn't matter, answer will be indirect in male only. That is a congenital hernia. This is their favorite topic. They ask this day after day, night after night, exam after exam. So patient had a breast cancer. 4.5 centimeters means it is T2. Okay. 4.5 centimeters means it's T2. Mobile lymph node means it is N1. So they didn't ask you what is T2 N1. They asked you the stage. So this is something you had to know. Stage 3 is locally advanced. Stage 2 is early cancer. So if it is T2 N1, which you see in this table, it will be 2B. So your answer is stage 2B. ठीक है? One बहुत घिसा पिटा question है. This was one of the tricky questions. I mean, this is the kind of question they ask in INICET. So if this question you made a mistake in, you should not feel bad. It's okay. If you use some common sense, which I have taught you in class, maybe you would have gotten it right. But this was one of the tricky questions. In fact, students could not understand what the question was saying. There was a long stem. Patient had a breast lump. It was removed. It was a lot of DCIS findings were given. And there was this word, 2 millimeter margin. This was given. This was one of the important points. Margin is 2 millimeters. What is the next step? Now, there is a way to calculate what you have to do next. But 2 millimeter means it is close margin, means some cancer cells may be left behind. It's possible. If cancer cells are left behind, what will you do? Give radiotherapy. So best answer here is radiotherapy. Don't say BCT. BCT is not done in DCIS, because in BCT you have to do lymph node biopsy. In DCIS there is no lymph node biopsy. Mastectomy could be the answer, but from the available information, radiotherapy is the best answer, because some cancer cells may be left behind. Easy question. They are given an image. Patient had dilated veins in the leg. Now either it is C1 or C2. From my understanding, students are saying they were very small. They were not varicose. They were reticular varices or spider veins. They were like spider nevi. So if it is spider nevi, it will be C1. Okay, chemo भी नहीं आएगा. DCIS में chemo भी नहीं देते, because there is no metastasis. There is no lymphadenectomy, correct? So it's either radiotherapy or mastectomy, but in my opinion, radiotherapy would be the expected answer. So more than 2 millimeter ही होगा ना? That means maybe little bit margin may be left behind, maybe. So here the answer would be C1. Was there a question on which vein is dilated? Anatomy question. ऐसी कोई question थी where which vein is dilated? Let me know in the comments, I will see. Okay. The reticular varices should not have swelling. If it's reticular veins, it is C1. Then this was easy question. They had given an image of a skin graft on the leg, which was meshed, right? It was meshed graft. So obviously there the answer is going to be split thickness. This lot of students confirmed. So there was a question on great saphenous vein. Okay. Okay, that I think is anatomy, but okay. We have covered it in our class. So this was split thickness. I don't know what the other options were. Students were like, 2 options were irrelevant. So I was like, very good. Again, I'm saying question had a big clinical stem, a lot of the questions, but I have made it short because that is as much as recall as I have gotten. I know exact questions were much bigger, so don't mind that. This was one of the nice, tricky question where they tested your understanding. Big clinical stem, burns patient, inhalational burns, soot over face, nasal hair was singed, carbon monoxide was high, oxygen saturation was low. Lot of things were given, and they had asked what is the next step. Obviously, in burns, how we resuscitate A, B, C, D, E. So first airway, then breathing, then circulation. Correct. So a lot of people felt answer should be A because he is having low saturation. But understand in inhalational burns, person is at risk of laryngeal edema, which manifests later. So the best answer here would be intubate. Okay, that would be the best answer. If there is hyperbaric oxygen, that is also fair. Okay, that is also not entirely wrong. But in my opinion, best answer would be intubation because he is at risk of laryngeal edema. One option was IV B12. Okay. Patient alert and tachypneic. Okay, more the reason to intubate. Okay, more the reason to intubate. Burn in neck, everything tells me there are inhalational ones. The history was suggestive of inhalational ones. This was normal. We have covered this in our chest trauma. So person has a stab in the neck and they had given the zone, and with common sense, you would have answered this question that there is air bubbling, means it's a tracheal injury. So what will you do in tracheal injury and what is the zone of the injury? This is zone 2. Zone 2 is the most common zone. And if there is tracheal injury, you are going to explore. So answer here will be zone 2 and exploration. Yeah. Deep burns neck and face, more the reason to intubate. It is only telling you that there is a airway injury because all those burns will cause problems. There is an inhalational injury. Okay, so your answer will be zone 2 explore. This is controversial. I don't know if Vivek sir discussed this. So if he's discussed, please let me know. And I'll tell you, I've taught this in class. I've even shared the table of degloving injury comes in what, but there are two schools of thought. So you have to choose what the question was actually asking. There was a lower limb wound, looked like a degloving wound, but students told me muscle was also cut. And what is the category of triage? See, degloving by itself is yellow. Okay, degloving by itself is yellow category. But if it is bleeding, obviously it becomes red. Goes without saying, you have to stop the bleeding. You can't put him in yellow and look at him after 1 hour. So if there is bleeding, answer is red. Goes without saying. Okay? Skin was off, muscle was hanging, bleeding. Yeah. So video, it was not a video, na? The video question, blood is coming. But yeah, if bleeding is there, automatically it becomes red. This I'm sure must be covered in anatomy. Constriction 40 centimeters is a diaphragmatic crura. So this we can skip. Easy question. There was a neonate with a very big cystic hygroma and they had asked for treatment. So treatment of cystic hygroma is to remove it. Students were like immediate or operate at 1 year. What do you think should be the answer? Will you operate immediately or operate at 1 year? By simple logic. The child is born, he has a big cystic hygroma on the neck. So what should you do? Yeah. And if there is any other option or anything more in the question, then you can tell me. So obviously, if the child is born with a big cystic hygroma, you will operate immediately because it can compress his airway. Maybe it caused difficulty in delivery also. We don't know that, but immediate operation would be my answer. Operate at 4 year. Okay. Why would they even put that? Operate at 4th year. Means they are just, playing with you. Okay. Aspirate or excise. Excision is the answer, but if there is a choice of immediate operation or excision, that is the best answer. This is a PYQ. This has been asked 3-4 times. It's there in all our ENDs, you will see. So there was a child with a cyst, outer canthus of the eye. That is a congenital dermoid cyst. Okay. Earlier they have asked. This is also a PYQ repeat. There was a swelling in the floor of the mouth. They had asked a diagnosis. I think it is ranula. Okay. This, I've gotten different versions of the question from different people. Okay. Different versions from different people. I'll tell you what is my thinking. This was also a clinical STEM question that they gave a lot of history. and then they had given an X-ray or an ultrasound of submandibular gland stones, right? So there was submandibular gland stones, and they had asked the treatment. Now, in principle, the treatment is removing the stones. You don't have to remove the gland. One option involved parotidectomy, one option was removing submandibular gland fully, one was partial. So submandibular gland fully is not necessary. Okay, that should not be the answer. Option A would be the best answer, and how to remove it depends on the size of the stone. Okay, the technique of removal is dependent on the size of the stone. Superficial submandibulectomy, yeah, we don't need to do it. With inflammation of gland, that is because of the stone. So this is little controversial, but in my opinion, answer should be remove the stone, the inflammation, everything should subside. Okay, this you have to tell me what the exact wordings were because the answers can change completely. Okay, the answer can change completely. So they had used these words, thyroid neoplasm. And question was asking how to look at extra thyroid spread. Was it extra thyroid spread or was it metastasis? Because if it is distant metastasis, then you will do iodine scan, whole body radioactive iodine after 3 to 6 weeks. If it is extra thyroid spread, then it should be MRI. Okay, stone size 1.4 centimeter, then you have to do open surgery to remove it. Okay, that answer I'll confirm with ENT, sir. Okay, the stone wall answer. So if here the question is extra thyroid spread, answer is MRI. Means you want to see how much it is going around the thyroid. Iodine scan would be for metastasis. Okay. This confirmed this question. There was a big clinical scenario. It was suggestive of tension pneumothorax, and they had given a chest X-ray also where you could see collapsed lung and black lung fields, chest fields. And they had asked what is the next step. So best answer is needle decompression. They didn't give triangle of safety, so second intercostal space is the next best answer. Okay, because this is new guideline, but they didn't give space to not confuse you. So option A would be the best answer. I don't know what the other options were. Students were like, in dono mein we had to think. Okay. We had to think in between these two only. So answer here is second intercostal space. Easy question. Post, they're given there is a D1 ulcer on the posterior wall, which is bleeding. What artery is affected? Gastroduodenal artery. So that is the easy one. Then there was a clinical scenario. They had given the triad of Boerhaave syndrome, chest pain, subcutaneous emphysema, and everything. And they had asked, how do you diagnose it? It is CT. CT with oral contrast, not endoscopy. Endoscopy is for corrosive injury. Here it is CT with oral contrast. Another easy question, after thyroid surgery, woman is not able to sing in a temple. What nerve is injured? This is going to be superior laryngeal nerve where you are not able to raise the pitch of your voice. Recurrent laryngeal nerve will cause hoarseness. This question, a lot of students could not properly understand. So whatever information I got and what I believe, I will tell you. Big clinical question. Elderly male, malnourished, steatorrhea. You thought it could be a malignancy. They had given a CT where there were things on the pancreas. Probably it was calcification. The levels were all normal. And they had asked, what is the next step? Okay, this was the question with an image of CT. There was a question like this with image of CT with some things on the pancreatic head, swelling of the head. So it sounds like chronic pancreatitis, especially if it is with a history of alcohol or something like that. Yeah, no malignancy is mentioned. Okay. So what is the next step? It should be enzyme supplements, in my opinion. If he has too much pain, you can do surgery for pain relief. Total pancreatectomy will not be the answer. Okay. Total pancreatectomy will not be the answer. Autoimmune pancreatitis, sausage-shaped lump, give corticosteroid. No, that is a different question. Okay. Fluid type. But if everything is normal, what it is acute pancreatitis with fluid collections, hard to say. If there is steatorrhea, it is chronic pancreatitis. Then there were some more questions which I didn't get completely. Okay, and some were very not really surgical. There was one cobra head on intravenous urogram. Steroids would not be used here. Steroids are not for chronic pancreatitis, especially if there is history of alcohol. And Whipple's is also not normally done for chronic pancreatitis unless there is pain. Unless there is pain. So one was IVU cobra head image. Then there was a very nice question. Now I don't have the exact question to give you the answer. Patient is undergoing TURP. Something goes wrong. He becomes drowsy. Basically, he's having TUR syndrome. And his sodium levels were borderline low, 120, 125. So there was a borderline low level. Now, they had asked, what is the management? One option was abort the procedure, which according to me is the correct answer. Abort the procedure, fluid restriction, he will be fine. If there is fluid overload, means if there was pulmonary edema features, then you will give diuretics. Okay, so 125 sodium was given. For 125, the treatment will be fluid restriction. Okay, it is fluid restriction. And abort the procedure, then don't continue with the surgery. You know you have a time limit in that. Okay. Then this question again, a lot of people, too much information got you confused. This I will have to check. You will have to help me with this. During lap cholecystectomy, surgeon accidentally cut some bile duct. And the question was, he is not very experienced. What should you do next? Two things can be done here. One is abort the procedure and put a drain. Other is convert to open. In which way the answer will go depends on what other information they are given. If he is inexperienced in laparoscopy, he can convert to open. But if he is inexperienced surgeon, then he will have to abort the procedure. It is one of the bailouts. Child with prolapse, that is pediatric question. That was a partial prolapse. That is pediatrics. You don't need to operate for that. Okay, and then facial nerve identification intraop, that was tracheal pointer or Conley pointer, easy question. So all in all, I have about 25 questions. Abort and drain is correct. I mean, it sounds correct. But if he is inexperienced, conversion to open will also not help. He was inexperienced in laparoscopy, then convert to open sounds better. Convert to open, no, don't repair bile duct. No, he has to be referred to higher center. I was asking about should he do open or continue? No, don't. He won't continue laparoscopically if he's inexperienced. Right? So I have about 25 odd questions, and I feel 18 to 20 were very acceptable, very attemptable, and 2-3 were tricky, and 2-3 were a little on the harder side. Biopsy from lesion of tongue, if it's ulcer, you take from the border. That is biopsy from the border. Okay. One option was ERCP stent. Yeah, I heard that. But if common bile duct is transected, then ERCP with stenting will not work. That is only for cystic leaks.